Hi, I'm Dr. Bryan DiMarco here at Renew Dental. We get a lot of questions about dental implants, so I'm here today to cover a few of the most commonly asked questions and hopefully give you a better understanding about the topic of dental implants. So first off, we hear is what are dental implants? So a dental implant is a treatment that is used to replace a missing tooth. Essentially, a dental implant is a man-made root that goes into the bone, and then a crown is placed on top of that implant to give it the shape of the missing tooth. So the next thing we get asked is what conditions would cause a dentist to recommend doing a dental implant? So the most common reason that we would recommend doing a dental implant is because we have a missing tooth in the mouth and we want to replace it so that you're able to better chew and also avoid damaging your other teeth due to the increased forces from chewing on them. So what are the advantages of dental implants? So there's a few main advantages. Number one is that the dental implant is the only treatment where we actually have the man-made root that goes into the bone. Why this is important is that the man-made root is going to allow your body to maintain the quantity of bone that you have in that area, which is important long-term for the success of your other teeth in that area, as well as when we lose bone in our mouth, it can cause us to look older. Another advantage of dental implants is that by replacing the missing tooth, you're going to have a bigger area to chew on. And this helps to support the other teeth around it so that they don't prematurely wear down and break and crack on us. So the next thing patients will ask us is what's involved in the process of getting a dental implant and what will I go through in the exam? So first off, starting the process of getting a dental implant is, yes, going to be the examination. During the exam, it's going to be like any other dental exam that we're doing, where we're going to take some x-rays of the area. We're going to see what things are looking like. We're also going to take a look inside your mouth and make sure that we do have enough space for this implant. We don't need to do things like orthodontic treatment first in order to move the teeth to have enough space to place the implant. The other thing that's unique about a dental implant is that we're also going to get a 3D x-ray called a CBCT, and this is really going to help us to evaluate the quantity and the quality of the bone that we have in the area where we're going to be placing the implant. So next, why is your medical history important? So with implants, there are a few different factors that can affect the success rate of the implant. So a few of the main things that we're looking for in your medical history is we want to make sure that we don't have any uncontrolled conditions such as uncontrolled diabetes. We also want to make sure that we're not smoking, because both of these conditions can severely impact the outcome of the implant. Then patients will ask, well, how will my dentist come up with a treatment plan that is right for me? So this is part of doing the examination, is that we're taking a look at the whole mouth and trying to figure out an individualized treatment plan for each patient. There's different factors depending on what the teeth are looking like on either side of the missing tooth, or if we have other areas where we're missing teeth that may impact the treatment that we recommend, whether that's going to be a single implant, a dental bridge, a denture. There's many different options that we'll look at and figure out which one works best for you. So another common thing patients will ask us is what is the process in terms of placing an implant, going from all the way from the tooth removal to the actual completion of the dental implant. Okay, so the first step of the dental implant would be that we do have a tooth that is missing or being removed. So generally we would be removing a tooth because it's no longer fixable. There's some major issue with it, whether it's a cavity that we can't fix or a crack or a break in the tooth, and we have to remove it. So the first appointment would be that we're going to look at removing this tooth. When we're doing a dental implant down the road, we usually will do a procedure with the removal, which is called ridge preservation. So what this treatment is that when we take the tooth out, we're going to put some bone in the area to try to maintain the quantity of bone that you already have surrounding your natural tooth. The ridge preservation helps to minimize the loss of bone after the tooth is extracted, in the hopes that we will have enough later on down the road when we look at putting an implant in the area. So next we have jawbone prep to dental implant placement. So once we've removed that tooth and we've done that ridge preservation procedure, generally that area is going to need about 3 to 4 months to heal. At that time, we would assess the jawbone and how much bone we have in that area. At that point, we would make a decision whether we're able to go right to placing the implant, or we're going to require additional procedures such as bone grafting, which means that we need to add bone to the area to have a large enough volume to place the implant. So the next part is the actual placement of the implant. So what will happen is that we need to put first the man-made root portion of the implant into the bone, and that's the implant surgery. So essentially we're going to be installing that into the jawbone, and then that is going to be what is going to support our implant crown. Once that implant is in place, we then are going to leave it for about 4 months so that it can integrate into the bone and the bone can grow around the implant so that it's solid and ready to go when we put our crown on it. So next step is going to be that we're going to place the abutment and the crown on the implant after it has successfully integrated. So at this point, that essentially means that we place the abutment, which is just a little piece that attaches into the implant, and we then have our crown, which sits on top of it. So another common question patients will ask is, will bone grafting be required? So bone grafting is required when we don't have adequate bone in the area to place our implant. The reason implants are successful is that they have bone that surrounds the implant, which helps to hold it in place so that it can take the forces of you chewing and using the tooth every day. Bone grafting means that we need to add bone to the area to increase the volume of it so that we have enough to support the implant. So the next question we get asked is, when patients are missing several teeth, they ask what options do they have in order to replace their missing teeth, whether this is going to be a removable or a fixed option. So when someone's missing several teeth, we can look at making them dentures to replace the many missing teeth. The two main options are the removable ones, where we have a couple of implants in the mouth and the denture clips onto them, but it can be removed. And then we have the other option, which is called the fixed denture, where it's actually screwed into the implants and it stays in your mouth, other than when you come in for cleanings and it's removed so that we can clean the implants. So those are the two main options. When looking at the pros and the cons for both, so for the removable option, one of the main pros is that it's going to be significantly cheaper than the fixed option. Some of the downsides of this, though, are that it is removable, which patients sometimes do not like. The other issue with it is that because it's not fixed in place, there is still going to be some movement with the denture, and this can cause some discomfort during chewing where food can still get caught underneath. As well, because it's still relying for some support on the gums, you will lose bone over time, and this can require more frequent replacement of the denture. So when we look at the fixed option, some of the main pros of that treatment are that the quality of it is extremely high and tend to get a lot better cosmetic result with that option. As well, patients generally like that they don't have to remove this denture, and it's very close to replacing the way their teeth were before they lost them. Some of the main downsides of the treatment, though, is that it does come with a very large expense. And then as well, you need to be diligent about coming in regularly for cleanings, because if we don't remove the denture and clean those dental implants, it can fail over time. So in terms of the recovery from the dental implant surgery, generally patients say that it's actually a lot easier than getting the tooth removed. Usually the extraction is the worst part of the whole process. In terms of the recovery from the surgery, it is normal that you are going to have some soreness in the area for a few days up to a week. Generally, we can manage this, though, with just regular extra strength Advil or Tylenol, and usually the recovery is fairly uneventful. So next, patients will ask me, how long do dental implants last? So once the implant is in place and it has integrated into the bone, implants can last a lifetime as long as they're being properly taken care of. One of the main things with implants is that they are still susceptible to gum disease like our other teeth are. So coming in regularly for cleanings and keeping up really good oral hygiene will help it to last a really long time. So patients will then ask, well, can my dental implant get cavities? And that's good news about that, is that dental implants cannot get cavities, so you don't need to worry about that. So patients will then ask, what are the costs associated with the dental implant and what are some of the financing options available? So the cost of dental implants does vary depending on the individual person and exactly what's needed, whether we need to do some bone grafting or not, and other factors. When it comes to dental implants, though, one of the good parts is because it is done in two separate parts, is that we generally will have some time between the two payments for the treatment, so that does help patients out. In terms of financing, we also are able to look into financing options to help the patients access treatment while not having such a large upfront cost. So patients will also ask, do most insurances cover the cost of dental implants? So again, it does vary for each insurance plan, but a dental implant is generally considered a major treatment, which usually most insurance plans will have at least some coverage for. So lastly, how can I schedule an appointment to talk to a dentist about dental implants? So just feel free to give our office a call at 204-817-6768, and we'd be happy to set you up for an appointment to talk about a dental implant and do an assessment to see if you're a good candidate. Otherwise, if you like, you can also submit a web form through our website, and we'll be in contact with you to set that up. I hope I was able to answer some of your questions about dental implants, but if you do have further questions or you are interested in getting a dental implant, please feel free to give us a call at 204-817-6768, and we'd be more than happy to help you.